All right. Good afternoon, everyone. Thank you for joining us here at the National Health Insurance Authority for our monthly beneficiary educational session. This afternoon, we are blessed with the presence of Miss Asia Carter, and she's a medical laboratory professional um, employed at the Family Medicine Center. So she is their representative for this afternoon. So a little bit about who we are and where and what are we. Our focus here at the National Health Insurance Authority. And so our vision statement speaks to us leading the way in providing access to affordable, quality healthcare that Bahamians deserve. Our mission statement, we are transforming the healthcare system upon which the future well-being of Bahamians depend by putting patients at the center of every decision that we make. At the National Health Insurance Authority, our core value speaks to us being passionate about bringing universal healthcare coverage to all Bahamians. We are progressive in expanding access to quality healthcare through progressive solutions supported by technology. Our partnership, we are dedicated to delivering affordable healthcare through partnerships. We operate with integrity and we are committed to doing business with integrity, accountability, transparency, and sincerity and respect. We honor our beneficiaries by providing care and respect in all aspects of our service. And so the NHI Bahamas Wellness Program, our focus is on three tenets. We encourage our beneficiaries and the public at large to one, incorporate exercise and physical activity into their daily routine. The second tenet is we want Bahamians, our beneficiaries, and the public at large to understand that food should be a medicine. And the third tenet is that we want them to focus on their mental, emotional, and spiritual health. The overall goal is to ensure that Bahamians understand the importance of living a well-balanced life that will ultimately lead to the enhancing of the overall health and well-being of our nation. And so where are we now in the NHI Bahamas program? Since our inception in 2017, we have worked very hard to deliver on the vision and to advance the path to universal healthcare coverage. Our focus is to provide access to affordable quality healthcare that Bahamians deserve. And so we boast that our enrollment growth consists of over 160,000 plus Bahamian citizens and residents who have enrolled in the program. Our demographics is very diverse. And so we've currently enrolled Bahamians from more than 17 islands, and the breakdown or the demographic consists of 7,000 plus Bahamians under the age of 5, more than 30,000 school-age children, and 20,000 plus over the age of 65. And we call this population our precious pearls. 96% of beneficiaries enrolled in the NHI Bahamas program are satisfied with the service that they are receiving from the program. Currently, we are in partnership with 133 physicians across 88 primary care facilities, and they are spread out across 8 islands. And we're also in partnership with 14 major labs across 21 locations. And we're happy to report that one of our partnerships this afternoon is with the Family Medicine Center. Our beneficiary information is documented in an electronic health record platform where the telehealth feature is enabled for applicable visits. And so access to digitally enabled care is afforded to all of our beneficiaries. And so what is covered under the NHI Bahamas program? Our benefits consist of general physician visits, annual physicals, maternity care, pediatric care coverage, periodic health assessments, laboratory testings, access to vaccines and immunizations, cancer screenings, HIV, AIDS, and STD screening, and chronic disease management. Around the world, the Global Medical Lab Week is observed April 20th to 26th, where the College of American Pathologists, also known as CAP, joined the community in celebrating the contributions of medical laboratory professionals, recognizing the precision, skill, and purpose they bring to patient care every day through quality and accuracy. The theme for the Global Medical Lab Week is For the Love of the Laboratory, Champions of Quality, United by Purpose. This afternoon, I'm happy to introduce a dedicated healthcare professional whose journey reflects both determination and growth. Asia Carter. She is a 2020 graduate of St. John's College, where she began her career in the medical field at Bonaventure Medical Laboratory just 1 year after completing her studies. Starting as a customer service representative, she quickly distinguished herself through her work ethic and adaptability, earning a promotion to administrative laboratory assistant. During her time there, Asia took on a range of critical responsibilities, including working with Laboratory Information Systems LIS, supporting laboratory audits, serving as a physician liaison, and leading efforts in NHI inspections and services. Her contributions did not go unnoticed. She was honored as a two-time Employee of the Year before moving on from the organization. Today, Asia continues to make her mark at Family Medicine Center within the laboratory department. In her current role, she oversees specimen processing and manages the international shipment of infectious specimens, playing a vital role in maintaining high standards of care and safety. As she continues to grow in the field, Asia Carter is undoubtedly setting a strong example for excellence in healthcare. And so, as Ms. Carter is presenting on the topic laboratory testing and your health, you are welcome to place all of your questions for Ms. Carter in the chat feature, whether you're logged in via Zoom or you're on our Facebook page. And we will read the questions for Ms. Carter during the question and answer session. Ladies and gentlemen, without further ado, I'd like to welcome Ms. Asia Carter from Family Medicine Center as she presents on the topic laboratory testing and your health. Welcome, Asia. The floor is yours.
Hi. Good day, everyone. Thank you, Ms. Sawyer, for my introduction. I do appreciate it. I'm going to start by sharing my screen so I could begin my presentation. So just give me one moment on that. All right. Oh, not this one. All right, Ms. Sawyer, just let me know if you could go ahead and let me know if everything is being seen on your end.
Yes. The
Okay.
slides are up. Thank you.
Alrighty. Once again, my name is Asia Carter. I am an administrative lab assistant at Family Medicine Center. And today, I'm really going to speak on the importance of the laboratory as we celebrate Lab Week. And actually, the theme of Lab Week is actually infinity and beyond. It's a Toy Story theme that we're just celebrating not only our jobs within the laboratory field, but also bringing recognition of us behind the scenes and what we do towards helping patients in terms of diagnosis and so forth. So, as I begin, what is laboratory testing? Laboratory testing is an analysis of samples such as blood, urine, tissue that is used to diagnose diseases, monitor health conditions, and guide treatment decisions. According to the AMT Association, 70% of medical diagnostics starts in the lab. So I want to talk a bit more in regards to when it speaks to monitoring health conditions. As you know, in the Bahamas, hypertension, diabetes, or even breast cancer is prevalent in our community. So when we talk about labs and how it connects to that, we make sure that for diabetic patients, we make sure we manage their care. So for diabetes patients, we do a test called A1C, which gives them a reading of how their sugar has been over the span of 3 months. And then, of course, with our hypertension patients, we have other tests to help manage their diseases as well as we have something called a BRCA testing, which is a genetic testing to see if patients are at higher risk of having certain cancers. So those are things would be connected to when we speak about monitoring health conditions. Now, it also helps guide treatment decisions. In most cases, or for some patients, before they even get their medication, you get tested, you get your lab works done, either to see if the medication that you're on is working for what's going on with you, or to see if what the doctor is going to recommend can work for you before even giving it to you. So that's where the lab really touch bases on in terms of those 3 steps. All right, so I'll move on. So, why does lab testing matter? So, I have detects diseases early, confirms or rules out diagnosis, once again, monitors chronic conditions, and evaluates treatment's effectiveness. So, one thing that I always like to speak about, especially in our young community, is doing early detection, especially for STD testing. Those are things that are very important to be attentive to, as well as even doing your annual every year. Because a lot of people in the Bahamas, I don't need to go to a doctor, I got bush medicine. In most cases, that could work, but how long can you say that could work for? So, being able to be able to go to your annuals every year or even following up with your follow-up appointments, those things matter. And doing the labs to go with those follow-ups or doing those labs to make sure to figure out if you need to go to the doctor is very important, especially once again from a lab perspective. All right. So as I move on, so when should you go? When should you get tested? So routine checkups when you're experiencing symptoms, chronic disease management before surgeries, and doctor recommendations. A lot of the time, one of the things that a lot of patients will be aware of that you have to do labs before you have surgery. So in cases, they just want to ensure that, in the event that you lose a lot of blood, they need to know what blood type you are in the event if it's safe for you to even have that surgery in the first place. Because in that pre-op assessment, you might have something that you never knew you had. So that might delay surgery, but in the event that could save your life because that could go in another direction that you didn't even think of. All right. When we touch bases on when experiencing symptoms. So I know some people when they get the flu, they just brush it off. That's a flu. I could drink Buckley's and that's it. Mind you, in some cases that works. That's understandable. But sometimes your doctor might say, well, this flu symptoms could be leading to something else. I think you should go to the lab. I have a request form for you to present to the lab so we can ensure we can check off all our check boxes to ensure it's nothing more than a flu. So that's what it means when we speak about experiencing symptoms. Now, another thing is doctor recommendations. So, what I could attest to that is just like, for example, for patients who are having allergic reactions to something, it could be something in the air, it could be something that they eat. So, we in the lab, we do something that's called allergy testing, or in some labs, they use something called an ALCAT. So, if a doctor is seeing that you're having these allergic reactions, or they're seeing that you're not getting better from the medication and the hives, they're going to recommend a laboratory testing called an ALCAT, where it could test either for moles, even water testing. There is a lab in the Bahamas that does water testing, and some other private labs in Nassau that does that. So when a doctor recommends something, it's not because they want you to spend all your money. It's because they want you to have a better outcome on life and just live your life on a normal basis without having any issues. All right. As I move to understanding your lab results. As we know now, everybody is accessible to technology. I understand that you probably want to go on TikTok or you probably want to go on chat to understand your lab results. That's understandable. You have free will to do that. But my recommendation is to always follow up with a doctor. Yes, you might get, and doing all those things like going on ChatGPT or even going on TikTok, that's building up your anxiety because you're not getting the proper explanation into your lab results. So always reach out to your doctor. They will always be the person that's going to explain what's going on with you if there's anything going on with you, in a better format. Even if they just give you a clear bill of health, it's better for that to come from them instead of a random person or a random AI source on ChatGPT or someone on TikTok. All right. So when we speak to understanding your lab results compared to normal results or normal versus abnormal results, or understanding your lab results influenced by age, gender, or lifestyle. And like I said, always consult with a healthcare professional. In some cases, it is easy to understand your lab results because sometimes you might see detected or not detected. But at the end of the day, it's always recommended that you speak to your physician in order for them to read the results to you in a format that's going to make you comfortable and in a format that's going to allow you to understand. All right. So once again, please don't use ChatGPT. Do not use any TikTok or any online source if it's not coming from your provider itself. All right. So mistakes before testing: not fasting when it's required, not informing the person drawing your bloods if you're on any medication, dehydration, and ignoring instructions. So one of the things that some people make the mistake of is not communicating that they are afraid of needles. So in the event of that, that's putting you in a bit of a harm as well as the person that's drawing your blood. Because the minute that they go in, you're fidgeting, you're moving. So things like that, you have to communicate with the person that's drawing your blood. Because if that's not communicated, like I said, you are going to be in a situation where you're going to be uncomfortable. Another thing that's connected to not communicating correctly is not communicating if you're fasting or not. Fasting is very important for certain labs because that determines the results of your testing. So let's just say you're not fasting. Your glucose could be all the way up here when normally it's all the way down here. You know what I mean? So being able to communicate not only helps your doctor recommend things properly, but it also makes the lab's job way easier. So imagine a scenario where a patient doesn't communicate that they're scared of needles. The patient doesn't communicate that they did not fast. You put that together, you're going to be in a situation that doesn't going to work with anybody. So in that case, you're going to have to get redrawn again because we can tell that you didn't fast. And then you're going to be upset that you have to get drawn again because you do not like needles. So communication is very key in the lab department. That's how we function. That's how we ensure that you get the right care management. Dehydration, even though you're supposed to be fasting, we always implement to drink plenty of water. Not only that helps the results for your labs, but that also gives you very juicy veins. So your phlebotomist will love you in that case if you are very hydrated. Ignoring instructions. Situations, some labs require you to take medication before you get the labs drawn. Some medications require you to stop completely before you get your labs drawn. Some laboratory testing requires instructions. Like, for example, we have something that's called a 24-hour creatinine clearance. So with that testing, what it is you give you a big jug. You have to walk around with a big orange jug and you're collecting your urine for a 24-hour period. So just following the instructions that come along with that is very important when we talk about ignoring instructions. All right. So I'm going to move on to the next slide. Mistakes during testing. As I said, movement or anxiety, not verifying personal information, poor communication. So I want to touch bases on not verifying personal information. Ensuring that your name is spelled correctly when it comes to the lab is very important. Knowing your date of birth or confirming your date of birth is very important. The reason why we say that is because that is one of the identifiers that we look for in the lab department. We look at your name, we look at your date of birth, we look at your sample ID number. When you don't confirm your information or your personal information, it does put us in a bit of a bind because let's just say, for example, you have the same name as another person. You guys have the same name, but what makes you different is your date of birth. But let's just say, for example, without that confirmation, you're going to end up with the date of birth with that same one as your same name. Mind you, there's going to be a slight difference between the two, but it's always best to confirm that information before any laboratory testing is begun because we don't want it to be a confusion between you or if that person comes in to do labs at the same time. So it's just to make sure that ethics standards are upheld as well as we ensure that your results are what's being tested at that time. All right, next slide. Mistakes after testing, misinterpreting results, ignoring abnormal results, no follow-up, delaying treatment. We find that in the lab world, a lot of patients don't follow up with their providers. And I feel like that's a tendency within the government clinics. Whereas because they say, oh, I got to go to the clinic, it could be a long wait. I don't want to wait. I'll see the doctor in the next 2 months when I think they're free. In some cases, that's not the right decision to make. Following up as soon as you can could save your life. Prolonging the process of seeing your doctor could put you in a bind where you're in the hospital. You could lead to sepsis or even lead to being fatal. So following up with your providers is very important. And that ties into ignoring abnormal results. You're going to look at a paper before, let's just say you get the results before you go to your doctor. You see something in red, you see something high, but you was just like, man, I could just drink more water or I could ease up on the conch snot. That's not the case. You're ignoring something that could lead to something worse in the long run. So that's why I also say don't try to interpret the results yourself and make that assumption. always go to your provider afterwards. Yes, the lab is going to run your testing and we're giving you those results, but at the end of the day, your doctor is responsible for interpreting those results for you. We can only start the process, they finish it off for you. All right. Another thing I want to talk about in terms of the lab is the relevance to our community. Early detection of diseases is very important, especially with HIV and AIDS. Those are things that I feel Bahamians need to be prevalent to. Under the NHI program, actually, they have the viral load and the CD4 that's covered under their program. They cover the costs for you. So I feel like within the lab world, take the opportunities that you have to get the early detection of the diseases as soon as possible. STD testing is covered under NHI. Please, if you are not signed up under NHI, please do. So even if you don't want to pay out of pocket, they could observe the cost for you. But at that point, at least we know that you're getting tested. That's what matters. And early detection really does matter. Also within the laboratory world, it improves public health. As I stated earlier, the lab world is about 70% of diagnostic testing. So therefore, we are a major part as to why your doctors can diagnose you. We are the major part as to why you're getting the treatment that you're getting, because in all honesty, it starts with the lab. Whether if you're going private or if you're going to government, it's always the lab. Another thing that I've been talking about is just encouraging awareness, even if in terms of that, the jobs within the laboratory field. A lot of people don't know about it because in the Bahamas, it's either you're becoming a nurse or you're becoming a doctor. It's never, oh, I'm going to be a radiology tech or I'm going to be a lab technician or a technologist. Sometimes it's difficult if you are not immersed within the healthcare field. So I just want to bring awareness to those. If you have kids, just make mention that a laboratory could be the option. Even if you're not running the test, there's laboratory assistants, or you have your phlebotomist that helps with the lab department, or you have your medical assistants. Those things are what we want to bring awareness to, that the lab is important and we do need people. The older generation within the lab department, they want to be in retirement. They want to go on the beach on the weekend and not have to worry about getting called into work. So we do need people within the lab world. It's very important. All right. And once again, we support the healthcare system. We are the backbone to your doctor. We are the backbone within the healthcare industry. And I feel like I want to toot the lab department's horn, because we don't get the recognition that we deserve. So with this lab week, I want people to honor what the lab does. I want people to know that we try our best behind the scenes to ensure that you get the best care as possible from us, you know? So I want to move on. But in conclusion, like I stated before, I just want to honor everybody within the lab world. And a special honoree I want to mention is Miss Karen Ingram. She was the lab administrator at PMH. Unfortunately, she did pass early in the year. I did not have the honor of meeting Miss Karen personally, but I am aware that she has touched the lives of a lot of people within the healthcare industry, and she has touched the lives of other people outside of the healthcare industry. And I hope she is going to be proud of the generation within the lab department and what they can do coming up in the near future. And I just want the people who knew Miss Karen to just honor her this lab week and just bring recognition to what she did to the laboratory industry and the things she was doing even before her demise, to ensure that the laboratory industry got the recognition that they deserve. All right. Another thing I also want to do is that I want to give a shout out to all the laboratory departments, whether it's hematology, whether it's serology, whether it's pathology, whether it is blood bank, whether it is chemistry, whether it's special chemistry, or whether it's the accessioning or specimen department, which is my department. Not to toot my own horn, but just everybody in the lab industry this week is for us. And I hope once again we get the recognition that we need and we get the support from the Bahamian people and the government, as well as everybody in the Bahamas. All right. And these are just a few slides of things that your medical technologist would see under the microscope. Another thing I want to show you is under the microscope. So this one of these samples is from a urine sample, and another thing, another picture is from a slide from a high vaginal swab. The first picture is from a urine sample. So this is an indication that someone had a UTI. And then you can see the white blood cells within under the microscope. And the second picture is a picture from a fecal sample. And as you can see, there is something strange within that stool sample. So these are some of the cool things that our lab technicians, or specifically our medical technologists, see on a daily basis. The first slide would have been, the first picture, sorry, would have been from what, this is called a plate. So what we do when the medical technologists, they would use either the source of the sample could be a urine or it could be a wound swab, and the wound swab could be either any part of the body. And then they plate it and then they put it in an incubator, and then whatever grows, it would give you an indication of what's going on inside of your body. If nothing grows, that means you're good in some cases, and in some cases, you end up having your plate looking like this, meaning that there is a sign of infection. All right, and this is just an example of what your urine could look like if there's something going on with you. It either could be there's something going wrong with you internally, or there is something that could be it could be caused by the medication that you're taking. It all depends on what's going on with you personally. All right, and once again, I just want to say happy lab week, and that is the end of my presentation.
Thank you so much, Lady Asia. That was such a wealth of knowledge. Thank you for opening up our eyes to what a medical laboratory is, their purpose, the medical laboratory professionals' purpose in the allied healthcare industry. We definitely appreciate you because, like you said, 70% of medical diagnostics start in the lab. And so oftentimes we go to the lab to get some type of specimen collected, whether it's a urine sample, a fecal sample, a blood sample. And then we're sitting there and we're waiting. And we understand the reason why we're waiting because there is a quality and a purposeful perspective as it relates to getting that result. And Correct. So that result often takes time. And it also requires us to be patient with our allied healthcare professionals and also Correct. With our physician. And so we thank you for your time. We thank you for your service. If you have any questions for Lady Asia, feel free to type it in the chat. And I will read those questions to her. So I'm just checking, Asia.
Okay.
All right. So we received the question. There is a question on Facebook. I'm trying to pull it up. Give me a second. All right. A question was placed on Facebook, Asia. How does diagnosing chronic illnesses early on, i.e. diabetes, help the patient?
It helps the patient get on the medication that they need. And if in some cases, it's either the patient has a sugar issue, or it's a scenario where they need insulin to be given to them. So in some cases, a patient would have something called a Dexcom. It either just checks their blood sugar or it either administers the insulin. So in terms from the laboratory's perspective, it manages or it catches on to see if you need to get to that point where you need to be constantly monitored. So with the laboratory testing in terms of diabetes patients, what they tend to do is check on them every 3 months. Like I would have mentioned earlier, the A1C is something that checks your sugar levels over the span of 3 months. So ensuring that picking on that early is very important, because in some diabetes cases, if you aren't attentive to that, let's just say, for example, a lot of people end up with feet issues. So in some cases, patients are going to get to the point where their feet is almost rotting, or it's called gangrene in a sense. You could lose a limb, you could lose your leg, you could lose because you're not maintaining that correctly. So early detection to see if you are diabetic is very important, because it could be very fatal in the end if not.
It could definitely save your life.
Correct.
Yes. Okay, so Asia, I know you were advocating for the medical laboratory professionals in the Bahamas, and the need for having more medical laboratory professionals.
Mhm.
What is the best way to get into a lab career?
Um, the best way to start, I would say, is if you are looking to be a laboratory technologist, there are schools that offer that in a bachelor's format. Once you do that, you do have to sit an exam to be certified. Now, if you just want to get your feet wet and you just want to be at an entry level, then you could become a medical technician. In some cases, it's either associate's degree or it could be a certification, I believe. I'm not too sure on the certification, but for sure it's an associate's degree. And the difference is, of course, the associates is 2 years, and then the bachelor's would be the 4 years. And then within the Bahamas, you have to get licensed with the Health Professions Board in order to practice or to become a technologist in the Bahamas. So that's how you can step your foot in. Now, if you don't want to be in the lab per se, but you just want to be able to assist the lab, I always recommend becoming a phlebotomist. That's really an entry level position. As well, if you want to become a medical assistant, I mean, you would have more other things that you would deal with in terms of that, but that's another way to really get within that field. But medical technician and medical technologist for sure is where you could look at your options.
Okay, so it sounds as if they are very there are different options, and there are a lot of options as it relates to becoming a medical laboratory professional. It all depends on the level that you want to land at. Yeah.
Correct.
All right.
Mhm.
In terms of courses that you can complete, I know you spoke to certification and doing some courses. Are any of those courses accessible here in the Bahamas, or you'd have to go abroad to do those courses?
I know what they're trying to do. They're trying to make it available in the Bahamas, so a lot of Bahamians don't have to go off to the States, or in some cases, they're able to do their program online. Because in the Bahamas, of course, I believe it's at the university campus or at the PMH facility. It says nursing program and allied health professionals, but
Mhm.
there's no allied health professionals at all for some reason. I'm not sure why that's on there, but anyway. Um, so in most cases, you will have to go off, especially if you're trying to do that bachelor's degree. A lot of people either go to the United States or sometimes they go to Jamaica. But in terms of other stuff, they're trying to make the program accessible for Bahamians in the country, especially with the dire need of needing technicians or even technologists.
Okay, so I think I would have saw something online a while ago about a phlebotomy course
Right.
that's offered here.
Yeah, so there is a lot of options to do the phlebotomy course. I know Bonaventure Medical Lab, they offer a phlebotomy course, as well as there's another phlebotomy program that's offered by Mastery Institute Phlebotomy. I think I might be saying that wrong. That's another phlebotomy program. I'm not sure if PHA, I know that PHA Academics, I'm not sure if they have that. I know they have other stuff along those line of allied health professions. But those two options for sure, Bonaventure. Oh, and also the BAMT. They also, as far as I know, they had or currently do have the phlebotomy program. I'm too sure about that one. But for sure, Bonaventure and the Mastery Institute of Phlebotomy Programs in the Bahamas.
Okay, thank you so much for that information.
Mhm.
And hopefully the information that you would have provided to us today, Ms. Carter, would not have fallen on some deaf ears, and we would
I hope so.
encourage some young persons and not so young persons to take on that challenge of joining the medical laboratory professionals in the Bahamas. Like you would have mentioned, it is a needed um, allied health profession that is very helpful, and that also needs continued growth as persons are transitioning off of the scene, whether it's for retirement and so on and
Yes.
so forth. Yes. And so I have not received any additional questions. I'm still looking, but I don't think I've received the comment. Love the presentation. I am a retired medical technologist, cytology specialty, and this is from Marita Strawn. And so we want to shout out to Ms. Strawn. Thank you
Thank
for
you.
your service to the healthcare profession as well. So Ms. Carter,
Hmm.
I want you to go back to a slide on, well, to something that you would have mentioned in your presentation. I can't remember this entirely on the slide, but you
Hmm.
gave us some branches of medical laboratory, I guess, the profession. or
Right.
areas that are covered. Like you spoke about the blood bank,
Mhm.
hematology. Can you list those branches of medical laboratory professions, please?
Okay, so you have the hematology department. So they are more, I mean, they're connected with a blood bank, but it's still separate. So hematology, they mainly deal with testing such as TBCs or your blood type or sickle cell or anything pertaining to whole blood mainly. Then you have your cytopathology department. They deal with specimens such as like your pap smears, as you know, or even something that's called a fine needle aspirate. They deal with testing on that scale. Then you have your serology testing. So serology is like your HIV, your hepatitis, your syphilis, and testing like that, as well as HIV testing. And then another department is the chemistry department. So the chemistry department would be like your lipid testing. And in the lab world, we have something that's called a SMAT 25. So what that is, that just checks for everything. That's your glucose, that's your cholesterol, that's your good your good cholesterol and your bad cholesterol. Another department is special chemistry. So special chemistry would be more so specific to stuff. Testing such as GAD 65. That's something pertaining to specialty testing, or I'm trying to remember off the top of my head. Special chemistry. What's that on machine? Which machine? Which machine? Um, Oh, your hormone testing. So that's considered on your thyroid function as well as within the special chemistry department. Another department, like I said, is blood bank. They would be responsible of dealing with when they're doing blood bank donations, as well as doing the screening for when you submit your donation for the blood bank. Another department, the microbiology department, and if Sharina is on this call, Sharina is at PMH, who is in the micro department. So they would deal with your urine samples, your stool samples, as well as swabs, as well as they do something that's called a sputum sample, things along those lines. They do. Am I missing anything? Probably, but that's what I have off the top of my head because the lab department is very vast and it's a lot of departments within that lab.
Yes.
Hmm.
Yeah. So thank you so much for helping us to identify those branches.
No
All
problem.
right. That you broke that down. We have a few ladies in on Facebook that says Happy Lab Week. And that's from Robin Nixon. And my phone just froze. And there's another lab tech that also said Happy Lab Week. And so we want to again reiterate Happy Lab Week. And I know we said that I think you would have mentioned a medical laboratory professional that's also on the call, Miss Rule. Welcome,
Mhm.
Miss Rule. And so, Miss Asia, I haven't received any additional questions, but I do want to say thank you for answering those questions very thoroughly and as best as you can. At this time, I'd like to turn over the call to Mrs. Cece LaFleur, and she is our Director of Human Resources, Facilities, and Wellness, and she will deliver the vote of thanks for this afternoon.
Good afternoon. Hope everyone is doing well this what is today? Hump Day, Wednesday. Miss Asia Carter, you ended your presentation by giving a shout out to someone who came before you, right? Miss Carrie Ingram, which was is so important because we stand on the shoulders of persons that
Mhm.
paved the way for us. But today I want to give you a shout out.
Thank
Thank
you.
you so, so very much for taking the time to really educate us
Hmm.
as it relates to all things labs. It stuck out to me when you said like 70% of all medical diagnostics start in the lab. That
Hmm.
tells us immediately how important it is
Right.
for us to not only go to our healthcare providers, but certainly to also follow up when they
Hmm.
ask you to go to labs to get testing, because
Right.
that tells you exactly how
Right.
and what the diagnosis will be.
Hmm.
What also stuck out to me is ignoring instructions. How do we tend to do that?
Very important.
Very important, and just mistakes during testing. So those were kind of my takeaways in my learning here. But this was truly relevant to all of us as we continuously, especially as it relates to our mission and vision here at the National Health Insurance Authority.
Mm-hmm.
That lab testing is such an important part of this journey as we continue to maintain our current level of awareness and elevating our own health and wellness. So once again, Ms. Carter, thank you so very much for your time today. We really appreciate it. It was very informative.
And thank you for having me. I really do appreciate it.
Yes, thank you. Chandra?
All right. Thank you, Cece, for the vote of thanks. And before we move on, and also thank everyone else for logging on, I also want to shout out to my sister, Crystal Curtis. I don't think she's on, but at some point she will watch. She is a clinical laboratory technologist at the University of Chicago. And so I also want to shout out to her. They're also celebrating All Week Asia. So I'm not sure the level of celebration at Family Medicine Center is going through right now, is doing right now this week, but her lab in Chicago, they've been celebrating from Monday. Every day there's something. And so we thank the world. We thank CAP for initiating the celebration of Global Medical Lab Week as we continue to honor and remember the dedication and the purpose of our medical laboratory professionals. We also at this time want to encourage and invite you to join us on Thursday, May 21st for another edition of the Power Hour, which is a complimentary workout for 1 hour from 6 to 7 p.m. right here at the National Health Insurance Authority at our headquarters. We're located on East Street and Purpose Way. On Friday, May 29th, save the dates where you can come and join us for our farmers market. You're also welcome to stop and have lunch, as well as participate in the mindfulness space and purchase some chair massages. And we've been talking about laboratory testing in your health, and tying in laboratory testing in your health is your annual wellness exam. I thank Ms. Asia for also mentioning and promoting the fact that laboratory testing is covered as a benefit on the National Health Insurance Program. And so, in conjunction with your laboratory tests, your annual wellness visit is also a very important benefit that we want to encourage our beneficiaries to take advantage of this year. Why do your annual wellness exam matter? It's part of the preventive care. Regular checkups help identify problems early, and it provides timely intervention and better outcomes. And Ms. Carter would have also mentioned that during her session today. It's an opportunity for you to get some personalized health advice from your provider who can tailor and offer dietary recommendation, exercise and lifestyle recommendations based on your current health status. And then it helps you to build a medical history. And so if you're participating in your annual wellness visits on an annual basis, you're able to track your numbers. You're able to know your numbers from year 1 to year 3. Where were you 5 years ago to where you are now? And how you can make sure and maintain your health. And so NHI is here to partner with you with your health and wellness. And we want to encourage you to book and schedule your annual wellness visit. And also when the time comes for you to follow through, to make sure that you go and sit down with your provider and complete the visit. And so this afternoon, should you wish to reach out to us, if you need to reassign yourself to a new provider, if you wish to sign up for the NHI Bahamas program, if you have any questions or queries, feel free to email us info@nhibahamas.gov.bs. You can reach us via telephone at 396-8500. You can also WhatsApp us at 813-2801. And you can also follow us on social media, Facebook, Instagram, LinkedIn, and Twitter. And you're also welcome to log on to our website at www.nhibahamas.gov.bs. Thank you so much for your time. Thank you so much for your engagement and for your questions this afternoon.